The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Good afternoon. Good afternoon. This is Christine Riley presenting. I am the Director of Homeless Prevention Policy and Planning with the Chicago Department of Family and Support Services, and you are here to attend the Shelter Provider Daily Reporting Training, and this is a joint training, our first annual joint training by the Department of Family and Support Services and the Salvation Army. Next slide, please. So again, thank you for attending today. We appreciate all of you. As we've always stated, we cannot do this work without you. We want to make sure that all of our agencies and the Salvation Army has a clear understanding of how to track your beds and report your beds. Also, we want a continuous, effortless effort with placing people in your shelters. So we are very excited to join you today and present to you today on the expectations from you. Next slide, please. I want to introduce, I'd like to introduce you to you who will be presenting today. Sarah and Andrea and the team, can you unmute yourselves and please introduce yourselves?
Sure. So my name is Sarah Valek. I am a program analyst with the Department of Family and Support Services Homeless Services Division, and I'm newer to the team, so it's wonderful to be here with you guys and to meet all of you. So I'm excited to be here today.
Well, good afternoon, everyone. I'm Andrea Chapman, Director of Homeless Services for the Chicago metro area with the Salvation Army. And also from the Salvation Army team, I have Miss Billy Woodard, who I'm going to allow to introduce herself now.
Hello, everyone. I'm Billy Woodard, diversion specialist, and I hope all of you are having a very good day.
We also have here Miss Andrea Chapman with the Salvation Army, who is our call center supervisor, handling our bed count reporting every day back to DFSS.
Andrea, can you say that again? You were very low. Sorry.
Oh, sorry about that. We also have Andrea Chapman, who is our call center supervisor. She handles all of our daily bed count reporting to DFSS from all of the many shelters that are on this call. So I'm going to also have Andrea Chapman, the other Andrea Chapman, introduce herself.
Hello, everyone. I'm Andrea Chapman.
Thank you, Andreas, Billy, and Sarah. So as you can see on our agenda today, we will be talking about reporting requirements, the reasons for reporting, daily bed reporting, how to report daily, talk about some areas of clarification, and allow you all to ask questions. At any time during this presentation, you have questions, please put them in the question box, or if you have access to chat, please put them there, and we'll be able to respond to you. Next slide, please. Part of your scope of services for every shelter that DFSS funds has a part in it that talks about the daily reporting. So you are expected to collect and report client level demographic, performance, and service data as stated in any resulting contract. This is a part of your scope of services, which is a part of your contract. So it's mandatory that you daily report your beds accurately to the Salvation Army. We do collect all of this information and use it in different reports that we put together for our different funders. So data reporting is a part of your contract, so I just wanted to let you all know that. So if we call and let you know that you have not been reporting your beds daily, that's an issue. So we want to make sure that you all know that data reporting is a part of your contract, and that shelter bed reporting is a part, is part of that reporting. Next slide, please. I'm going to turn it over to Sarah.
Thank you so much, Christine. So kind of talking about daily reports, which is what we're all here to talk about today, I'm going to go over a little bit of why we're asking for this information from you guys, and then kind of what exactly it is that we're asking for. And then after that, Andrea is going to go through a little bit of the more specific communications, like when they're going to be asking for this information, how you can communicate with Salvation Army, and all of those pieces on their end as well. And if at any point you have any questions or concerns or anything, please feel free to put them in the comment or the chat box. So daily reports background. The kind of the purposes of the daily reporting are that we would like to understand shifts and trends in the shelter system, better understand the bed utilization amongst different subpopulations throughout our system, make the necessary adjustments to the shelter system when needed to meet the evolving needs of individuals and families in the shelter system, and to support shelter providers like you guys and the Salvation Army in connecting on making placements to open beds in the shelter system whenever that is possible. So really the daily reporting is just the way in which we're able to truly understand what's going on in our shelters every single day. And so with that, it's really important that you guys are reporting the correct information to the Salvation Army at least once a shift, which is what we're here to talk about today. If there's changes in your capacity during a shift, the Salvation Army does need to know that information as well so that they can really work with you to make sure that they're placing people only when beds are available. And if there's an issue with this for your shelter, for example, I know some of the youth shelters are overnight only, or sometimes there might be staffing shortages or things of that nature. It's totally all right. We just need to know that information so that we can collaborate with you on what might be the best practices for you reporting for your shelter. So those are just really things to raise to the Salvation Army so that we can really work with you on how reporting might work best for all of us. And so reporting open beds, the main thing of this whole training that I want you to understand is it is not a bad thing to report open beds. The shelter system is meant to have turnover and availability within it, and open beds mean that new placements can be made, which is always a good thing. So really reporting just simply allows us to support placements within your shelters and the available beds that there are, and to ensure that the shelter system is reflective of the evolving unhoused population's needs, especially when the demand for shelter might be more than the amount of shelter beds that we have currently. So really making sure that we're putting people in open beds when we can. And so with that, I kind of wanted to talk a little bit about what exactly it is that the Salvation Army is asking on a daily basis. And I do see in the questions box, does this training apply to interim shelter DV? It applies to all shelters who report to the Salvation Army on a daily basis. So yes, it would apply to DV shelters as well. And so with the daily requests, what Salvation Army is really looking for are, first of all, notes on your shelter's availability and anything that might be affecting your bed capacity. So this could be anything like if you maybe have some isolation going on within your shelter due to COVID, if your shelter has a room under repair, or if a bed's broken and that affects your capacity numbers, or maybe if you had a long-term family staying with you and it's taking a little bit longer to kind of turn over the room they were in. Anything of that sort is really things that the Salvation Army would like to know and needs to know so that we can better understand what's going on within the shelter system. Beyond that, the other two pieces are open bed availability, which are going to be those available beds, and occupied beds in your shelter. So those are those physically filled beds, or beds that are intended to be physically filled if, say, you're not open during the day, but you know who's coming back at night to be staying there. And I'm going to go over those two pieces a little bit more in depth as well. So as I said, the open beds are really the available beds per shift in your shelter. And we understand that it can be very difficult for everyone to know what's happening in the shelter at all different times. You can always let the Salvation Army know who might be best to contact with further questions or concerns related to bed reporting. If maybe at the time they first call, the person who answers doesn't know that information or isn't certain about it. We understand that there's always kind of moving pieces, especially within the shelter system. And we really just want to make sure that we have the open lines of communication to get the best information that is as accurate as it possibly can be. So with open beds, I wanted to kind of give you guys an example of what reporting might look like. And so say you have a capacity of 36 beds and all of those beds are open. There's none that are under repair or anything like that. So say that the first report, you have 34 people staying with you in your shelter. And so you say, okay, we have 34 occupied beds and 2 open beds when Salvation Army asks you. Say then during the first shift still 2 people leave your shelter for the day and they say, we're not going to be coming back. So you turn over their beds and those are now also open beds. When Salvation Army reaches out in the second shift then, you would say, okay, so we do have 4 open beds now. We have 32 occupied beds and then those 2 original open beds plus the 2 new open beds, which gets us to our capacity of 36. And then say Salvation Army says, perfect, we have someone looking for a bed. We're going to send you 1 placement. And then they send that person to you and the day continues on. And when shift 3 calls to report, then you would tell them, okay, so we now have 33 occupied beds because of that placement that was just made and 3 open beds because there's 3 that people are not placed in currently. And so that's kind of the breakdown of open and occupied beds. And I know that it seems almost simple, but it can get very confusing when people are moving and the pieces of a shelter are moving. So no worries if you ever have any confusion or anything, you can always let us know and we can kind of help you determine what your open and occupied numbers should look like. And then occupied beds, again, are the number of physically filled beds or those intended to be physically filled. If your shelter maybe has a policy regarding holding an individual or family's beds for a certain amount of time, or again, if you're not open during the day, so they're not currently physically there, but you know they're coming back. So those beds that are going to be physically filled by a person that night are the occupied beds to be reporting on. And so then with that, we also want to say that we recognize that your open and your occupied beds may or may not always equal your contracted max capacity beds. Sometimes you might have beds that are, again, closed for isolation or broken or under repair, or you might have a family of 3 in a room that has 5 beds in which you would have kind of 3 occupied beds, but those other 2 wouldn't necessarily be available beds or open beds because those 3 family members are already in that room, so you wouldn't want people being placed with them. Things of that nature could affect the amount of open and available or open and occupied beds not necessarily equaling max capacity. And I know that's where a lot of confusion can come in. So again, if you ever need some clarification, please just let us know. And then if your open and occupied beds are not equal to your max capacity, always just kind of letting the Salvation Army know what reason that might be. So again, letting them know when maybe you're isolating and that might be taking a couple of your beds offline, or if a room is under construction or one of the beds is broken, just letting them know those pieces so that we can keep track of how many beds are truly available within your shelter at a certain time. And then with that, it's also really important to report accurately on the number of beds, even if it does seem lower than your capacity or lower than you normally have, because it really just helps us to understand how much availability we have within the shelter system. Again, I want to emphasize that it's not a bad thing to have open beds. It's actually very helpful to the shelter system, and it shows that individuals are moving through the system. So really reporting accurately is never a bad thing. And so now I'm going to turn it over to Andrea and the Salvation Army to kind of talk through some of their pieces regarding the daily reporting on their end of things.
Hi, this is Billy Woodard. So I just want to just talk to you about the timelines that we're working with. So the Salvation Army will always reach out to the shelters during the following times. Our first shift, which is midnight, starts at midnight. So it'll be between 12 a.m. and 12:30 a.m. Our second shift is from 8, we'll reach out to the shelters between 8 a.m. and 8:30 a.m. And our third shift, which starts at 4, between 4 o'clock and 4:30 p.m. We'll be reaching out. If there's a change in your bed report between those shifts, we do ask that if you can call us or contact a member of our staff as soon as you have those available numbers so that we can adjust our report accordingly to reach out as many families as we can. Next. The supportive plan for shelter intakes, what's best for the shelters? Well, what we want to definitely do is just realize that that change of shift, meal times, and other unforeseen emergencies may cause the delay in reporting bed availability or prevent shelter staff from answering phones. However, beds should be reported as soon as possible as you have those numbers. But we definitely understand having our own shelters that there could be a number of things that may delay that process. All available beds must be reported. The Salvation Army will not send an influx of people. We never would want to do that at any one time. Even if there are multiple openings reported, we won't bring 10 people there because you said you have 10 available beds. That's just not feasible for anyone. The Salvation Army may also be able to coordinate or stagger transports that is also works with your convenience to provide supportive transport for consumers and effectively work with shelter staff based on their capacity. Next slide. Okay. Who will Salvation Army be contacting? Well, the TSA, we will reach out to all frontline staff first, and the number that has been issued to us, the main shelter number that is provided, we will always make that call to that number first. Please make sure that your frontline staff are answering the phone, who are answering the phones, report an accurate bed count as best to their knowledge. And also, if you could please report phone outages, any internet outages that may affect reporting immediately, as well as outages as they have been restored. Also, if you could please be sure that staff communicating pending arrivals for shelter during that they communicate that any pending arrivals to the staff as they're changing shifts. This will prevent any confusion and any undue stress for the client at this time, at the time of drop off. Next slide.
The refresher. What information should be reported each shift? Of course, it's the open bed availability, your occupied beds, any open but unavailable beds if applicable. That will include isolation beds, any beds offline for isolation space, any beds offline due to facility repairs. If there are repairs to be done, please notify the Salvation Army of repairs and an estimate timeline of completion. Longer than usual turnovers. Anything else that affects your bed capacity, increases or decreases in capacity must be reported to the Salvation Army immediately.
All right, and then I wanted to just go over a couple of areas of clarification here. So just as a reminder, reporting really is a mandatory piece of your scope of services. So it's really important that we are communicating on this piece and that we are trying to get the information as accurate as possible. Shelter really is meant to also be available 24/7 unless you're designated as an overnight only shelter. So kind of keeping that in mind as the Salvation Army is reaching out to you and making sure that we are being communicative when things are coming up that might affect that. And then just recognizing that referrals should not really necessarily ever be paused to your own shelter. If there's a reason for which you feel that you can't take in any new placements, this is really something you should be letting the Salvation Army or us over at the Department of Family and Services Support Services know so that we can really discuss with you and work on what might be happening that might be causing you to not be able to intake some of those new referrals. And then placements are really made through the 311 system exclusively for the shelter system, except for youth walk-ins. We really ask that you please do not send individuals down to 10 South Kedzie or any of the other community service centers with the promise of a placement in your shelter particularly. Placements are really done through the 311 system in order to be done in an equitable manner. And it makes it really difficult when someone comes over to 10 South Kedzie or contacts the Salvation Army and lets them know that they've already been told there's an opening for them. The 311 system is really meant to be our kind of input to the shelter system. So always kind of just connecting someone back to the 311 system if they are looking for shelter within your shelter or another shelter, and they haven't made contact with that system already. And then additionally, if you have any questions at any point about the placement process or a particular placement, you can contact the Salvation Army as well. On the DFSS side, I also wanted to let you know that looking ahead, we are going to be comparing HMIS bed counts reporting in Shelter Point to some daily bed counts on these reports to Salvation Army. I know that not everyone uses HMIS or Shelter Point, so no worries if you do not. This is just something that we're going to be looking at to kind of see if reporting seems to be happening accurately on both sides, and to kind of follow up if there's any issues that we're identifying or discrepancies between the two. So that one I just wanted to add so that people kind of knew that that was happening on our end of things. And then now I'm going to turn it back to the Salvation Army really quickly for them to do a couple areas of clarification on their end as well.
Just to clarify, the Salvation Army will not send a huge influx of people immediately if you report bed openings. The goal is to work with each of you to coordinate placement that you are actually able to receive in a compassionate and respectful manner with the consumers in mind. We understand staffing turnover, we understand staffing shortage, we understand the need for isolation, we understand the need for quarantine and facility repairs. So if you have a bed available for placement, but no intake staff available at the time that we are wanting to place or transport someone to your facility, you can take in a placement for the evening and do a full assessment with the staff once they are available the next day. The goal is to safely and get consumers to shelter without delaying the wait time because of factors happening within shelter. So please remember, if you report 20 beds, you won't receive 20 consumers or 20 clients seeking shelter in one transport or in one shift, unless that is something that we have already pre-scheduled and coordinated with you and know that your staff can handle that. We don't often have the capacity to do that large transport without coordinating that ahead of time. So please don't stop intakes because you are short-staffed and you're worried about an influx of people coming at one time. Reporting is a tool for us to smoothly run the shelter system and to work together to overcome issues related to placement and support the people that rely on our services. It is not a gotcha moment. We are not trying to catch up. We're really just trying to handle the volume of requests that we see each day and safely and quickly get people into shelter.
If I can chime in after that, Andrea and Sarah, wanting to just emphasize this process for everyone. This is for all DFSS funded shelters, all DFSS funded shelters. So if you're DV, you're reporting 3 times a day. If you're under our shelter, if you're regular shelters, family, singles, youth, you're reporting 3 times a day. It's very important. Also, we wanted to emphasize your overnight and weekend staff need to have this information as well. Salvation Army needs to have access to your shelter. Access to your shelter is 24 hours a day, 7 days a week. We do not want to be reported to that Salvation Army said that one of your shelters said intake hours are over. Access to your shelter program is 24 hours a day, 7 days a week. So your overnight staff needs to know what to do when receiving a person overnight. They need to answer the phone. The weekend staff as well, they need to know how to report the numbers. So this is not only for Monday through Friday staff, it's for overnight staff, it's for weekend staff. Everybody needs to be on the same page. We're trying to improve how people are placed in shelter. We're trying to improve the ability to place in shelter and the speed in which they're placed in shelter. No one wants to wait a long time. Go ahead, Sarah.
Thank you very much. Yeah, I think that those are really important points as well, because we really are just trying to do this to really kind of have the smoothest running system we can to really work all together and to really serve the individuals that we all are looking to serve together. And so with that, we're kind of at the questions portion of the webinar. So really our main questions are, do you need any clarification on any of the reporting pieces? How can we best support you in reporting accurately to the Salvation Army during the day? Do you have any other questions or concerns that came up during this? And then also, do you have, I know we're asking a lot of communication pieces from you. Do you have things that you would like communication on from the Salvation Army? Is there any ways we can improve our partnerships with you? These are all things that we kind of want to hear about. So if you have any questions or thoughts or anything like that, please feel free to put them in the chat or the question box, and we'll kind of go through those for now. So looking through it, things that I've seen already are, again, kind of, does this apply to DV shelters? It applies to all of the DFSS funded shelters, as Christine said. So if you are funded by us, you really should be reporting those 3 times a day. And if you have a specific question about whether or not your program might be needing to report to the Salvation Army, you can always definitely reach out to us or the Salvation Army. We will have our contact information on a slide at the end of this presentation as well. Another question I'm seeing is, how many is considered a huge influx? Is it a specific number? And I would say that a huge influx is really dependent on the shelter and their capacity, as well as their staff's capacity. I think really the goal here is that we can really communicate in a way that we know what your capacity is, what you might be able to take on in that time, and if you can't take in placements right then, how we can work with you to develop kind of a timeline that's going to work for both you and the Salvation Army to get those placements made without overwhelming your staff. Does that kind of seem correct, Andrea and team, or do you guys have any other thoughts on that question?
That definitely seems correct. Just one other thing, what we want to make sure is that the full bed count is still reported. So what we want is a full bed count, and we need more detail and reason as to why we cannot access or use all of those beds at the time that they're reported. So if you report 20, it is helpful and necessary for your staff to say that if they say I'm the only staff working the shift this evening, we have staff shortage, we know that having 5 intakes and you're the only person managing your shelter, not just the intake process, sometimes for many shelter it is the actual shelter, that is an unsafe situation to put shelter staff in. What we do not want is for shelter staff to say, I'm the only person here, so I'm reporting 3 beds. Only 3 people can come. Because what we can do with those 3 intakes is just not bring 3 people at the same time. We could bring one this hour, wait a few hours, bring someone else, wait another couple hours, bring someone else. So that's why we need the full bed reported, not what shelters may want to take at this moment, but what is available for us to use, and then any circumstance or situation that is going on to help us make an informed decision on how to stagger transports and placements.
Also, it's Christine Riley here. Just wanted to make a point of clarification too. I mentioned the overnight staff. We are not expecting the overnight staff when they receive a client to do a full intake on that client that evening. They'll have the paperwork from Salvation Army. It's okay for them just to put them in bed if it's at midnight, 11 o'clock at night, 2 o'clock in the morning. They can give them their room, put them to bed, and the actual intake can happen in the morning. We are not expecting you to do a full intake, keeping that person up in the middle of the night to get all of their information. So I just wanted to make that clear as well.
Thank you for the clarification. Another question I'm seeing here is, are we no longer able to take any walk-ins, even if they have put in a ticket with 311 before they came to our shelter asking for a bed? And this is from not a youth provider. And I will kick that over to Christine or Andrea.
I can answer it first and Andrea can follow up. Our shelters, other than youth providers, are not to accept any walk-ins. That's the, if you're not a youth provider, you should be receiving all of your referrals through 311 through Salvation Army. You should not be accepting walk-ins. The reason we have the clearinghouse in which Salvation Army manages is so that we know the beds that you have in your shelter. I'll give you an example. If someone walks up to your shelter, you say they can have a bed, you report that bed to Salvation Army. Salvation Army thinks that that's a bed available for them to place somebody. They then try and place somebody. You've already given that bed, quote unquote, to somebody else. Everyone should be going through the 311 system. You should not be accepting walk-ins. If someone comes to your shelter, you'll let them know that they should call 311 for shelter placement. And this is if you are not a youth shelter. The youth shelters are the only ones who accept walk-ins. Andrea, anything else?
That was perfect.
And then there's a specific call out that DV shelters have previously reported to the DV hotline and not to the Salvation Army. Christine or Andrea, do you have a follow-up on that? Sorry, I just don't necessarily.
Yes, if you are a DFSS funded program, you should always, we've had trainings on this before with regards to for DFSS funded programs, you should always be reporting 3 times a day to Salvation Army. Before it was Salvation Army, you should have been reporting 3 times a day to the other agency that was running the mobile program, mobile shelter placement program. Yes, if you are funded by DFSS, you will be reporting 3 times a day to Salvation Army if you are a DV provider. So if you haven't been doing so, you're starting today.
And then I see a question here that's saying, just for clarity, are we calling in or is the Salvation Army calling us? So the Salvation Army should be calling you at the different shifts that were mentioned earlier today. However, if you have something change within your shelter, you can also reach out to them to let them know that information. For example,
clarification, really quick.
Yeah.
Clarification as well. At the beginning, and Andrea, you can correct me if I'm wrong, at the beginning of every shift, your person also should be calling Salvation Army.
Absolutely, because what happens a lot is that we are making calls to shelters and someone has stepped away from the phone and you don't realize you've missed the call. So at the start of your shifts at shelters, you should be calling us. We have our times listed on when we will call you, but you should always be calling us at the start of your shift to report any available beds in your facility as your shifts start.
And then someone's asking kind of what is the best way to handle people who come to their door asking for shelter when they have open beds, but that individual has to go through the 311 system. So do either of you have any insight on kind of any good way to connect that person back to the 311 system or how they should be responding in those cases?
You can always direct them to, if it's during the week, you can direct them to a service center if they have no place to, a safe place to stay. You can direct them to a library if it's open. But again, I mean, if you have a waiting room or, a waiting area, if you're available, allowing them to stay. I don't know if the hospitals are opening up their doors yet to emergency rooms, but unfortunately, if you have available beds, you need to be reporting those to Salvation Army.
And then a related follow-up was kind of, can we still refer those in need to shelter to the local police station or hospital so that 311 may be called for them, in particular for those who don't have phones?
Because we have, because of the time we live in COVID and this pandemic, some police stations have opened up their lobbies and allowed people to do so. Some hospitals have done that as well. So you can still refer people. It's just, I don't know if everyone is doing it now. This was like an unwritten partnership that we've had for over a number of years, but I do believe so now hospitals and police stations are allowing people to come in and place a call. But please know that it's, what was I going to say? They can, people can also call from a friend's house, or if, they know someone from a store or something, because they no longer are only picked up from a police station or a hospital. Salvation Army will pick up from wherever that person is waiting for shelter.
Perfect. And then, yeah, I'm seeing some insights come in of things that shelter providers would like to kind of be, that they have insight on, which are very helpful on our ends regarding some things like when a family may or may not be coming to shelter, being notified of that, and then some interesting information about youth and some of their insights on youth shelters and when individuals are being brought over to youth shelters. So that's definitely information that we'll take in on our end, and we'll definitely follow up if we have any questions or concerns on that. Another question that came in is DV shelters also are supposed to accept walk-ins. Is that correct?
I will have to follow up on that. I believe, well, walk-ins meaning from the Illinois Domestic Violence Hotline walk-ins, or I will have to follow up on that. But I'm not certain of that in regards to walk-ins.
All right.
We will get back to you about that one.
And then one person asked, are call-ins seen by all the callers at the Salvation Army? Sometimes we feel that we receive a call right after we call to report our own bed counts. So is there a way that everyone kind of knows when a shelter has been contacted or not?
I'll let Andrea and her team answer that.
Sarah, can you repeat that question? We didn't hear that one.
Yeah. Is there a way in which kind of your whole team in the dispatch center know when a shelter has contacted, or when you guys have already made contact with the shelter? This person was saying sometimes they feel like they get a call right after they called to report the bed count. So they were just kind of wondering if there was a way in which you all share that information with each
That
other.
information is shared throughout all shifts. So there's a tracking report that everyone in our call center uses. Sometimes our confusion is on bed reporting. When we have gotten one number from one shift at a shelter and the very next person will report something else, and then we call to place and we're being told 0 beds, or no, we can't, I can only take the one. I don't have 3 beds, we only have 1. So a lot of times there is a lot of confusion around the beds that have been reported, people that have already been accepted from another shift. And at the shelter level, this is why we're asking that you communicate those changes from shift to shift, because we are getting one report at, sometimes the shelter will call us at 2 o'clock to say, now we have 3 beds. We think we can send over 3 individuals. But when our team makes a call at 4 p.m. just to confirm that you still have those 3 beds, then we'll get something like 1 bed or 0 beds. And so we've got to do a little fact finding to see who we talk to at 3 p.m. And we've got to figure out if we've actually placed anyone between 3 and 4 in that bed, so that we can then call you back to say, we need you to confirm your bed count, because we've not placed anyone, we've not transported. So the bed count is different. So you will get follow-up calls. Just because we call or you report a bed, if there is some inaccuracy in that reporting, our staff will ask the question again. We are not asking it in a confrontational way. We just need clarification on what the accurate bed count is.
Perfect. Yeah, I think when it's kind of a moving system like the shelter system is, it's always going to be a little bit difficult to for sure be on top of exactly who talked to who, but it's always good to have open communication, and always better to kind of follow up with a question than to be unsure. So I think that's definitely fair. And then another question that came in is, if a consumer shows up at our door without a referral, is it okay for staff to contact 311 on behalf of the consumer and allow them to wait on the premises for transportation from Salvation Army?
Yes, if you're comfortable and you will allow them to wait for shelter, and they've if they've called 311 and have an SR number, that's perfectly fine. Also, if you have that SR number, and if Salvation Army calls, you can let them know that you have somebody waiting for shelter and they've called 311. But yeah, definitely, if you're comfortable allowing them to wait, and they can be picked up Salvation Army to be taken to an open bed, that's perfectly fine.
Please
Okay.
keep in mind that we may actually, if you've got that open bed and someone else is more appropriate for that bed, we may come and drop off someone else and pick up that other person. It does not mean that that person will be the person staying at your facility. Because oftentimes what we're seeing is the beds are reported only when someone shows up at the door and we're being told, we can take this person. Can you come over and do a referral? But 0 beds have been reported throughout the day. There is no, the system does not allow for customized shelter placements. We try it as much as we can, but sometimes your facility may be more supportive for someone else to sleep in that bed and others that have been waiting longer than the person that walked up to your door. So just because that person walked up to your door, at the time that we come out, we may be bringing you a different person to sleep in that actual bed and taking that person with us to another location.
Right. And then another thing we're seeing is someone asking kind of what's the best way to handle walk-ins when the police might drop them off and then kind of leave them there. Is there a specific way they should be going about that, or is it kind of just best to connect them back to 311 and with the hope of eventually connecting them back to the shelter system?
The best thing is to allow them to call 311. And we hopefully we'll be working with our partners at CPD and the police for them not to do that. We're in communication actually with our hospital system to start that process of, well, Salvation Army has already started having meetings with our, several hospitals, but to put something coordinated together, because we have had hospitals drop off as well clients to different shelters, because we want them to know the process as well. So yes, if a police drops them off at your facility, please, again, it's about them calling 311. Thank you for that question.
Yeah, I would say that's also a good thing to raise to the Salvation Army, or else if it's something that happens very often, because if we're doing that work to kind of connect with those individuals or organizations and systems, then we can definitely try and connect with them to also think about what might be a better pathway moving forward. Another question that I'm seeing is sometimes we get told that individuals are on their way and they don't appear. How many beds should we be reporting when we know that 2 individuals, for example, might be on the way? So I will hand that one over to Andrea, I believe.
Sarah, can you kind of summarize the question?
Yeah. So kind of if a shelter provider is told that individuals are on the way to them, but they don't appear, maybe they didn't get transportation, maybe they weren't there when you arrived to transport them, anything of that sort. How should they be reporting their beds? Should they be considering those beds as occupied for those individuals that are supposed to be on the way? And kind of how long should a bed remain available for a transport, either from you guys, or also there's a question about the same sort of idea, but with self-transport as well.
So what they want to do is just call the Salvation Army call center back to find out if that person is still coming. So what will happen if a person has walked away or has gone on arrival or changed locations and it's going to delay the transport? Our team should communicate that. But oftentimes it's a number of hours. So it's the same as if they're not gone on arrival. We're not putting a cap time or an end time on the time that you are accepting to the time that we're going to be transporting. Because you have to keep in mind that this is not just a program for shelter transport. So many shelter providers think that this team just goes around, picks people up, drops them off at shelters. That is not the case. There are things that take priority over shelter transports. That's senior well-being checks. Our teams are responsible for all senior well-being checks in the city of Chicago that come in each day. There are fires that we respond to with Red Cross. That's also a priority that happens. Any of these emergencies could stall or change a transport to shelter, and those become the priority. Or we could get family transports that interrupt a single man or woman's placement because youth are very vulnerable. We could get a youth placement. We could get a number of things to change a transport and delay the amount of time it will now take us to get to your facility. So communication is going to be really key. We don't want to put a cap on that, because what will happen is shelters will think, oh, well, it's been that 5 hour, it's been 6 hour. We have to, then we can report this bed again. And then you'll end up with 2 people coming to your facility for the same bed. So that is not the way we want that handled. We want to just keep communicating. If you call, if that person is gone on arrival, or no longer seeking shelter, our team will call you back to let you know the person has walked away, they declined shelter, they were gone on arrival when we transported that. We're going to close those cases out. They're no longer coming to you, which means that bed is still available for you to report. But if we have not made that call, oftentimes we are still expecting to bring that person. So that bed is not considered available. Your next shift should report that. If there's a change of shift, just report that simply as, we have 1 bed, we're still waiting for John Doe to be transported. You communicate your pending transports when you do your bed count. So anything like Andrea said earlier, anything that increases or decreases your number, communicate that at the time that you report the bed, especially if you have accepted someone and have a shift change, but that person has not arrived. You still want to communicate the pending transport you're expecting in that available bed.
Also, I received clarification about the DV shelters accepting walk-ins. Yes, DV and youth accept walk-ins. So if you're a DV shelter funded by DFSS, yes, you receive walk-ins. But that does not mean that you do not report to DFSS. We're still asking you to report the change in bed to Salvation Army. So if you accepted a walk-in, you need to let Salvation Army know that that number has changed. Because if you haven't reported to them that that number has changed, they will still assume that that bed is available. Thank you for that question and that clarification.
Yeah, I think a big thing that's really come up for me is that it's kind of always better to over communicate than under communicate or leave yourself with questions. So knowing that it's always okay to follow up if you have a question or a concern or you're not certain about something that's going on, because it really just helps us to fully understand what's happening within the system and to really work with you on what should be reported and what should be going on, really. I'm seeing some interesting youth-specific and DV-specific questions. For those ones, I want you to know that I'm kind of taking those down and that we'll definitely follow up with you. But as we're getting closer to the time here, I'm just trying to kind of get the main general questions out of the way. I see this note about also doing informational sessions with nursing homes about their connection to the shelter system. I think that is also very, very smart. So definitely making a note of that. Someone is asking, if the Salvation Army brings a disgruntled client who refuses placement and maybe damages property, who should those concerns be reported to? And then similarly, if the police are called, how can they report correct information to get that to the police department and the Salvation Army?
So I have had an agency, I remember recently contact me, but it was a couple days after the incident happens. If something serious happens, and a lot of the shelters, you guys are awesome in communicating this anyway. If something serious happens at your shelter, you should notify us immediately. Definitely email the DFSS-homeless@cityofchicago.org email address. I have that on my phone. This is Christine Riley. Most of you have my cell phone numbers. Give me a call. 24 hours a day, 7 days a week. I'm always up. So you should report it to us as soon as it happens. If something also happens and a client has threatened your staff, has caused damage to your property, also let Salvation Army know, because this is something that when we hear something from you all, we contact Salvation Army so that they know. We do not want to put your staff or your facility in harm's way. That's something we don't want. Andrea, if you want to add something, please add.
Well, thank you for that, Christine. Definitely utilize the DFSS-homeless email to report any issue or concern that happens in your facility, making sure to include that in the discharge information in HMIS so that we can see that system-wide. Contacting DFSS gets that information to us right away. Please understand that when we are transporting, our staff is also vulnerable, and we're on wheels doing that, right? We're out in the street picking people up. We do not want to take someone who is aggressive or violent and put them back in the vehicle and transport them to another shelter because they've made another 311 call. So not reporting that right away to DFSS and Sal Army does not help us protect the other shelters in the system. It does not protect our staff from incidents that could occur because we don't have the information. So you want to report that right away.
Yes, and I'm seeing a couple people ask for that email. That'll be on the next slide, and then we will also get the slides out to you, so you'll have that email there as well. But it's dfsshomeless@cityofchicago.org. And then I'm also seeing the note about kind of connecting with the hospitals as well and seeing some issues with the way that they're interacting with the system. So those are definitely notes that we will take and kind of make note of in our conversations with them about kind of how we can best coordinate the systems within the city of Chicago to serve everybody. And hopefully keep it kind of organized. So we are definitely looking at those things, and those are always very helpful for us to know about if you're having issues with a particular system or anything, so that we can kind of keep that in mind and connect with them on how to best coordinate for our shelter system. So that seems to be all of the comments I have seen. If I missed your comment, please feel free to toss it back in the box. I know there were a couple youth-specific comments that I took some notes on, so I'll reach out to you for follow-up on those specifically. But we know that this was a lot of information as well, and that comments or questions or concerns or anything might continue to come up in the upcoming days. And please feel free to reach out to us for sure about any comments or questions that you have as you're going through the reporting. We really, again, just want this to be a collaborative effort to really understand our shelter system and to best work with each other in order to serve the individuals that we're all looking to serve in the best ways that we can. And so we kind of want to thank you, and I'm going to turn it over to Christine to kind of close us out for the day.
Thank you. And Sarah, were any youth-specific questions that came in was regarding bed reporting or outside of bed reporting that you're gonna address? I want to make sure Salvation Army has a chance to respond if there was anything specific to the bed reporting for youth.
Yeah, they were kind of about the hours that the youth providers are currently operating and kind of specific questions about what they should be doing.
Yeah. So
Then.
yeah, we and I'll let Andrea talk on that. We actually had a meeting with some of the youth providers last week. And Andrea, can you share with them about like how they should report even if their actual shelter doesn't open in the evening? Oh, until the evening. I'm sorry.
Sure. Those beds for youth providers should still be reported on every shift. We understand that you take walk-ins, so once your shelter is open, you may have a number of walk-ins or folks already waiting to get into your shelter. Call us to update that count. So at 4 p.m., you reported, for example, 8 beds, and when you open at 8 p.m., you've already got 8 people that have walked in. We need you to call us back by 8:15 to report 0 so that we are not trying to transport folks to your facility. But please still report those beds for us. And we do understand that you don't open until the evenings and the same, but we still need those beds because we're planning throughout the day for service requests that are coming in for youth. We're planning based off of what you've informed us at the start of your day at 8 a.m. that you may have available. We've probably have 8 people for those 8 beds that you've identified already, but we're going to need to know that that's no longer an option for us if you take walk-ins before we are able to get someone there.
Thank you. And just again, thank you, everybody. We truly appreciate all of you. We truly appreciate the hard work that and care that you have shown the clients inside your facilities. This has been a trying time for all of us during this pandemic. We appreciate your openness. We again appreciate your hard work. We know that a lot of our shelter staff, you may not be at full capacity, so we appreciate all of your staff who've worked overtime, all of your administrative staff, your leadership staff who've worked overtime to continue to allow your shelter to operate. So we cannot do this, of course, as we say with the pig count, we cannot do this without you. We are a hands-on kind of funder, so we will call you. We're open for you to call us. These slides will be shared with you. Again, please share them with all of your staff, your frontline staff, your intake staff, your case managers, just in case there's a question. Please distribute to staff who may give daily bed reports. Please allow your overnight staff and your weekend staff also to have this information. We will be doing check-ins with Salvation Army to find out if there are shelters not reporting 3 times a day, not giving reports. So this is something that we find, and we're trying to create a more efficient way to report beds. So again, we thank you, and please reach out to us. The email address is on the next slide. So here's all of our contact information. So the email address I mentioned is dfss-homeless@cityofchicago.org. You have Andrea Chapman's information and and email address, her program manager, Lisa Rowland, Billy Woodard, and then Andrea Chapman, the call center supervisor.
And those are 2 different Andrea Chapmans, just so
2 different
knows.
Andrea Chapman. There's Andrea M and Andrea T. I was confused myself as well when I first found that out. But please, please, please give us a call if you have any questions. Thank you to Sarah. Thank you to Andrea, and Billy as well. Have a great weekend, everyone.
Bye, everybody.
Thank you.